in the intense world of medical emergencies,
One patient, 3 times stab wounds.
there's nothing more extreme than a code red.
This is a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got 1 male still trapped in the vehicle.
In the West Midlands, a highly specialist team are on call 24/7, ready to race to these major traumas.
ETA 4 minutes.
By road and air,
03, we are lifted from Cosford.
responding to the most severe 999 calls,
Open up the Lucas device over there for me.
day and night.
All right, well done.
From car crashes
Yeah, just need to check.
to stabbings.
We're going to put some oxygen on you, pal.
Here, where time is critical, lives will be saved. On roadsides, in back gardens, and inside homes.
Okay, coming off the chest.
These emergency doctors and paramedics use cutting-edge trauma techniques and surgery normally only seen in operating theatres to save people from almost certain death.
Sorry, mate.
I know, mate. I know. We're going to sort you out.
Filmed over 2 months with the critical care team,
Ready, set, slide.
we captured every vital second as these specialist crews work to save lives.
On roll. Ready, steady, roll.
Tonight, a desperate 999 call leads to multiple casualties in a major car crash.
There's people trapped in the car, covered in blood, and she's screaming.
Where's your worst pain? In your chest?
A woman with asthma suffers a cardiac arrest.
Let's get some adrenaline. We've got 40 seconds until the next rhythm check.
A scooter accident inflicts devastating injuries.
I'll be quite a lot of pain there.
Yeah, we're on it. We're on it.
Get your pain sorted out, mate.
And police, fire brigade and ambulance race to the scene of a stabbing.
Any details as to whether they're conscious breathing or not? Over.
Heavy blood loss.
Right, that's done. Yeah. So I've got all the amps and kits in here.
At the Queen Elizabeth Hospital in Birmingham, critical care paramedic Ian Locke and Dr. Richard Brown have just dropped off a patient and are restocking their fast response vehicle with drugs and equipment for the rest of the shift.
We're going to try and get all the kit together in good order. So if we are required that we know where the essential kit is ready to go. So organised chaos is how I'd like to describe it.
Hello?
I've had a car crash, please, from an hour.
Okay, are you injured?
Yeah, really bad.
Okay, all right, listen, what's the address? Where are you?
I don't know.
Ask somebody to help you.
I thought I'm in the middle of the road.
Okay, are you out of the car?
Yeah, the car's in the tree.
The car's in the tree?
Yeah, but my friends are trapped.
How many people are in the car?
3.
We found you, my love. Okay, stay on the side.
I think I broke my back. Ow! Ow! Ow!
4 ambulances, multiple police units and 2 fire engines have been called to the site.
Mike Delta 98 on channel, leaving QE now.
Critical care backup is also urgently required, so Richard and Ian need to get there fast.
Got 1 male, 2 females still trapped in the vehicle. One's possibly got an impalement injury on a tree tip.
Hi, Delta 98, that was all copied. Our ETA is approximately 3 to 4 minutes, over.
With multiple casualties, this is a major incident, requiring all the emergency services to work together to save lives.
My Delta 98 at scene, over.
Roger, thank you. All see.
Right, Tim. How you doing? You all right?
On arrival, they are briefed by West Midlands Ambulance Tactical Incident Commander Tim, who is coordinating the whole emergency effort.
So you've got 1 patient that's been ejected.
Yeah.
on this ambulance here. We've got 3 more in there. One is just being dragged out, a male patient. Got some concerns over his airway.
Okay.
We've got 2 more patients in the back. They're lying on top of each other at the moment, so we're just trying to get a plan to get them out.
Okay.
The 4 friends were returning from a restaurant when the car lost control before hitting trees and landing on its roof. One female passenger in her 20s was ejected from the vehicle and has just been moved onto the ambulance.
If one of you can have a quick look, because they're pretty much packaged and they can get going.
Okay,
right.
Can I have a quick eye on this one?
Yeah. If you could also look at the chap that they dragged out that's potentially got airway.
Yeah. Hello guys, you all right?
How you doing? You okay?
Hello. What have we got? Very quickly.
The patient on the ambulance is the woman who called 999. She is complaining of severe back pain. She is also bleeding from a head injury.
Jack, very quickly, patient 1 is the ejected female, is a GCS 14/15, good bilateral radials, moving all 4 limbs. We'll get the crew to ring you when they're ready to go with an Atlas for Worcester. Okay.
With her spine immobilised, Ian and Richard decide that she is stable enough to be taken to hospital.
Right, that's patient 1.
An ambulance crew prepare to take her, leaving the critical care team to assess the rest of the crash victims.
That one's going to Worcester. You wanted us to have a look at the one that's being dragged out?
Yeah, if you don't mind.
Where are they? Just point us.
It's this person with green shirt on the floor here.
Have a look over here, okay. What have we got?
The driver, a man in his 40s, is in a much more serious condition.
Is he speaking to you at all? Just about, yeah.
He was pulled from his seat by the ambulance crew and is now on a stretcher and only semi-conscious.
This chap dragged out. He was not able to be laid flat at all.
Okay.
He started to become
okay.
rolled to his side. Quite a lot of blood coming back in his airway.
Okay, so I'll just get around that way. We'll just scoop him on his side if that's where he'll be. Can you open your eyes, my friend?
Whoa.
Where's your worst pain? In your chest. Are you happy on your side or lying on your back?
As Ian and Richard try to assess his injuries, screams are heard from the wreckage of the car, where the other 2 passengers are still trapped.
It's going one way, isn't it?
Ambulance services, the patient breathing.
The critical care team and Midlands Air Ambulance cover an area of around 6,000 square miles.
203 lifted with an ETA of 4 minutes.
The largest operating area of any specialist trauma unit in the country.
Just coming into the overhead lane.
In a 12-hour shift, they will respond to around 8 life-threatening emergencies. The most frequent call-outs are to serious traumas from road traffic collisions and cardiac arrests.
That is our Lucas chest compression device. It's on the specialist platforms such as the critical care car. I think it's going to be rolled out eventually onto the air ambulances as well.
At the start of his shift, critical care paramedic Pete Edwards is testing a mechanical resuscitation device not carried on ambulances, but included as standard on the critical care team's cars.
It does continuous chest compressions, and it's a machine, it's automated, so you don't get operator fatigue. It frees up a pair of hands on scene if you're short of resources. And also, if we're going to transport the patient to hospital in cardiac arrest, it makes the journey a lot safer because you don't have to have somebody standing up in a moving vehicle doing CPR. It's all in there.
Ambulance services, the patient breathing.
No.
No breathing at all.
No.
Patient male or female?
Female.
How old is she?
How old is she, ma'am? 40, 50?
Do you have access to an automatic defibrillator?
No.
No, okay. I'm going to tell you how to do CPR. Get her flat on the back on the floor.
She's not breathing and her face is going just like that.
Okay, well, the quicker we start CPR, the more chance she's got then, darling. Keep pushing hard and fast until anything changes. So the rate we go in is 1, 2, 3. 1, 2, 3. 1, 2, 3. Keep going.
6-2.
That's all received, thank you.
Today, Pete is paired with fellow critical care paramedic Mike Andrews. As well as the critical care team, ambulance crews and a specialist resuscitation unit have all been called to the scene.
It's a patient who's in their 50s, who's in cardiac arrest. That's not been confirmed yet because we don't have any resources on scene, although they should be, just according to dispatch.
With cardiac arrests, time is everything. Every minute that goes by without someone attempting a resuscitation, the chances of survival drop by 10%.
Hello, my name's Mike. I'm one of the paramedics. Okay. Hello, guys. You all right there? How do you...
On arrival, ambulance crew members are working hard to save support worker Vanessa.
Okay, was she asystolic when you got here? Yeah. Okay, so first crew, she was asystolic.
Basically, we went out. We've done a few rounds of compressions. We're trying to get access because we need to give adrenaline.
She has been asystolic without a heartbeat since they got there.
Are you family? Yeah, is it your mum? Your auntie. What's happened? Is she an asthmatic? Okay. Have you found her in cardiac arrest?
Earlier, Vanessa, who was alone at the time, called a relative to tell them she was having an asthma attack. When she failed to answer her phone after they called back, her nephew went round and found the 50-year-old collapsed. No one knows how long ago her heart stopped beating.
We've got an IGL in airway and tidal's a little bit low, so we just have to go slow on the ventilations.
Okay.
And we're just getting the reversible courses now.
I'll tell you what, I'll come round the top end. Do you want to run it and I'll go to the top end?
All right.
Mike and Pete will now take over advanced life support. Because Vanessa doesn't have a heartbeat, it can't be shocked back into a workable rhythm with a defibrillator. So they will use chest compressions and drugs to try to get it started again.
Okay, should we pause for a quick rhythm check so we can all reset and we get our timings right? So, okay, let's check for pulse in 2 places, please.
Nothing here, mate.
Okay, so that looks like asystole to me. Back on the chest then for 2 minutes, and let's see where we're going.
After each cycle of chest compressions, Pete checks to see if there is the slightest spark of life.
Hello, how you doing? Hello there, all right, how's it going?
What do you want us to be doing?
We've got this lady, known asthmatic.
Okay.
She's found a relative.
3 members of the West Midlands care team, specialists in accidents and resuscitation, arrive on scene.
So, just done a pulse check. We're 1 minute 20 to the next pulse check, but she's in asystole, so we're going to start trying to redress some reversible causes. Okay. All right, so have we got any access? Okay, let's get some adrenaline and the glucose set up if we can. You got in glucose, yeah? You're doing the adrenaline. Okay.
Adrenaline and glucose are stimulants that could trigger activity in Vanessa's heart.
Everybody, just a second. 15 seconds from next pulse check. We're going to take a little break in CPR and get the Lucas device on. So 8 seconds, if everybody just stands back while the care team get the Lucas device deployed. So 3, 2, 1, okay. Quick pulse check, rhythm check. It's still asystole.
After 18 minutes of manual CPR, the Lucas machine will now take over chest compressions.
So we've got continuous CPR going now.
The entire team are doing everything they can, but with Vanessa still showing no signs of life, Pete knows they don't have much time left to save her.
Can we just do a pulse check? What have we got there?
Write it all down.
Okay, there's no pulse.
Okay.
Are you happy on your side or lying on your back?
In Redditch, Ian and Richard are at the scene of a serious road traffic accident.
Can you lift this leg for me?
The driver is on the ground, semi-conscious. The full extent of his injuries is still unknown.
At the minute he's talking, he's able to speak. He said he's got pain in his chest and he wants to go onto his back. He's quite cold, but we'll just get him on his back and get him off. Have a look from there. There you go, just roll onto your back, my friend. Go to your back. There you go.
With the help of the fire brigade, the man is rolled over.
Guys, are you okay just to give hands and we'll lift him straight on the stretcher?
He's bleeding from a wound to his head.
On the, You stay there, bro. We're going to get you on the ambulance, okay? Well done.
One female passenger in her 20s has already left the scene in an ambulance. The remaining 2 passengers are still trapped in the back of the car.
How you doing? Okay.
Given the high number of casualties, extra resources have arrived.
First casualty that was ejected, we've just had a quick once over the ambulance. She's obviously trauma tool negative, so we've said Worcester for her.
Ian and Richard will focus on the driver, leaving the West Midlands care team to take over the trapped passengers when they are freed.
This chap, they've also got out. They were concerned about his airway, but he's talking. So doing another assessment now that he's on the trolley. And there's 2 people still in there that are trying to get out. So we've not had any eyes on them, but the heart team are in there trying to get them out.
The Hazardous Area Response Team are specialists trained to extricate and treat patients in dangerous situations. The fire brigade and ambulance crew are working against the clock to free the 2 remaining female passengers.
Please.
One woman is bleeding from her head. An hour and 8 minutes after the 999 call, the last 2 patients are brought out of the wreckage and are on their way to receiving emergency treatment. On board one of the ambulances, Ian has had the chance to examine the driver, and his condition is deteriorating. He needs to get to hospital fast.
If you get to the point we want to intervene further, we just give a shout, pull over, jump on in the back, and then we'll go from there. Is that all right? Okay. Happy? Yeah. Yeah.
Ian and Richard will travel with him to provide continual care throughout the 20-minute journey.
So it's a male, we think in his late 40s. Injuries-wise, it looks like he's definitely got maxillofacial fractures and possible head injury as well. He's got a black eye on the right with a very swollen, deformed right cheek. His GCS was 13 and he's a bit agitated. So query head injury. He's been cannulated and he's had some ketamine sedation, a total of 40 milligrams so far.
Arriving at hospital, Ian and Richard deliver their critically ill patient to the waiting emergency doctors.
So it's quite a different job, that from what you're probably used to dealing with. So significant ITC with quite a few patients.
After a complex multi-service job, everyone can take stock and learn valuable lessons for the future.
It's very important, so particularly that job where there's lots of people there working and lots of things going on. It's quite useful to, at the end, go through what happened at the job, what we did, what could have been done better, and it's quite useful for the crews, for their learning, because most of the regular ambulance crews don't go to jobs like that very often at all, probably once a year, if that.
It's Wednesday night, and Dr. Scott Beattie and critical care paramedic Will Meadows are at the beginning of a 12-hour night shift.
Just ahead, turn left.
Dr. Scott is a consultant in emergency medicine at Salford Royal Emergency Department in Greater Manchester and does a shift a week for the critical care team.
I can't think of a more textbook definition of a team that, in terms that everyone comes from a different background, but we're much better as a unit because we bring all our different skills and it all just comes together. It's a very dynamic team.
Will has recently completed his advanced critical care training, and this is his first night as part of the all-night trauma response unit.
This is my first shift. First sort of solo shift with the doc. So Scott's got his hands full tonight.
Au contraire.
Ambulance service, please.
Hello.
can you have assistance to Kitchen Lane for a stabbing?
A stabbing, okay. And what's the address to come to?
Near the top of Kitchen Lane, bleeding heavily to the chest, man is barely talking. He's just found him.
Stabbed to the chest, was that?
Yeah, stabbed to the chest.
Attacker on scene?
Not known. It's a passerby that's come across him.
The police have requested an ambulance to attend the scene of a reported stabbing. With a man's life in danger, critical care backup is urgently needed.
9-8.
Got 8, stabbing in the chest.
Yeah, any details as to whether conscious breathing or not, over?
Nope, there's not even a vehicle assigned to it. I don't think they've even got the location quite right yet, but heavy blood loss.
82, over.
Last year, there were almost 4,000 knife crimes in the West Midlands. It's an ever-increasing part of the critical care team's workload.
So reports of a stabbing of a male stabbed in the chest with heavy blood loss, but we're not sure of any other details at this stage. But certainly heavy blood loss suggests that something fairly significant has been damaged. Even the smallest of little wounds could go in a very long way and hit some fairly vital organs. So quite complex, quite worrying.
If the blade has cut an artery or punctured a major organ, the man could bleed out and die in minutes. Scotland will know that the sooner they get there, the better chance they have of saving his life.
Airway is good, so
airway's good with the eyes, mate.
We're doing hypoxia, yeah. Hypovolemia, we've got fluids.
That's glucose running.
Okay, so we're doing the BM as a metabolic disorder.
In Edgbaston, critical care paramedics Mike Andrews and Pete Edwards team fighting to save 50-year-old asthmatic Vanessa, who was found collapsed with no heartbeat.
We've got 40 seconds until the next rhythm check.
But after 20 minutes of fighting to get her heart started, there is still no sign of life. Several of her family members are in the next room.
Will this move under her legs? Let's raise her legs, see if that helps anything. Okay, so if you push something under that, or that little table, whatever's easiest.
By raising Vanessa's legs, Pete hopes gravity will send blood closer to her heart and may prompt it to restart.
That's it, love. Okay, that'll do. Let's just keep her legs there. I know it's created a bit less room, but we've raised her legs a little bit. All right.
No one is sure how long before Vanessa was found her heart stopped beating, and time is running out for them to save her.
Can I just stop us there? We're just due next pulse check. Okay, that's pulse check there. No adrenaline on this cycle with the next one.
So there's no pulse at the carotid.
And end tidal is 1.3 despite 20 minutes of good ALS. But can somebody have to have a chat with family regarding that, or is that all right? And I'll continue with timings. Is that all right? Okay, yeah, let's continue.
Because they attend only the most serious cases, critical care paramedics see death day in, day out.
Is anybody in a position to find out the time of the call?
Their hardest decision is always when to stop trying to save a life.
So, what we're just thinking is, we've got an unknown downtime. We have had some CPR on crew arrival, but we don't know when she's actually arrested, and blue on arrival apparently. So the things that are going against us, she's not been in a shockable rhythm at any point. We've done 20 minutes of ALS.
20 minutes on the monitor.
Okay. Do we need to reconsult family, or are you happy with that, Bobby? Has anybody got any objections to stopping? Okay, is everybody happy to stop him? Recognition of life extinct. By my time, that's 16:13.
A crew member informs Vanessa's relatives that despite their best efforts, she has died.
Shut the door.
Yeah, definitely. So, on lift, ready, step, lift, into here. Yeah, put it up there, right? It can be emotionally draining, I think, but at the same time, you have to sort of detach yourself from the emotional side of it if you can. There will always be jobs where you can't detach yourself. There'll always be those jobs that always stick in our minds that we all keep locked away somewhere, the jobs that, you know, you can't really forget. But I think you've got to be quite thick-skinned.
There are more than 30,000 out-of-hospital cardiac arrests in the UK every year. The overall survival rate is just 1 in 10. In Wolverhampton, Dr. Scott Beattie and critical care paramedic Will Meadows are en route to a stabbing. A passerby called police after he found a man with a serious chest wound lying by the side of the road.
4668, thank you. No more details of hospital.
Is there an RVP, or are we? They haven't told us one, have they?
With violent incidents like stabbings where multiple units are scrambled, police usually arrive first and secure the scene, while ambulance and critical care crews head to a meeting point nearby.
Just to confirm with you, you will be the first ambulance resource in attendance. We've had nothing come back from police.
Mike Delta 98, sorry, just to clarify, are we heading to an RVP or can we go straight to scene over?
Not out, just getting an update from police. I'll take us straight to scene. Police are in the vicinity.
98, yeah, perfect. We have approximately 4 minutes left to run over.
For the critical care team, reducing the number of deaths from stabbings is a top priority.
Nothing, Seaton, not clear.
Their skills and experience with treating major bleeding and shock are vital when it comes to saving lives.
Okay, that's received, thank you. Are police there? Are you made contact with her? No, they don't say please. They are just in the area, so if you could just see if you can locate and call back on her. No problem.
The ambulance crew has just arrived on scene, but with no sign of the incident or police, they radio back to control for further instructions. It's now been 14 minutes since the emergency call was made.
Whiskey 55, liaise with police. It looks like it may be a malicious call. They're calling the caller back and trying to make contact with them.
At the moment, the impression from the police and the first crews on scene is that, yeah, it's a malicious call. Unfortunately, it's not uncommon. We get a fair few. And it's just obviously a significant waste of resources.
You have reached your destination.
Right, I'm going to send you down. I think if there's anything, we'd have found it by now.
Yeah, 98, understood. Yard.
With no sign of any stabbing victim, the police have decided that it's been a hoax call and a wasted journey for everyone.
Obviously, make contact with medics. Going to stand the crew and myself down. Police standing down also.
Last year, West Midlands Ambulance Service received over 1,000 malicious calls. In the time they've been dealing with this prank, Ambulance Control have taken 50 real emergency calls.
I guess you don't feel quite mad. It's when you launch the helicopters, you're up in the sky and everything, and that's just a huge amount of money wasted for someone's entertainment.
Ambulance service, patient breathing.
There's been an accident on the Litchfield Road by the traffic light. A BMW has just knocked a man off his bike.
Is the patient breathing and conscious?
He's got pains in his chest.
Right, is he awake?
Yes, he's awake. Don't move him. Don't move him. He's got chest pain and I think... Oh, they're on the left-hand side. all down the left-hand side, really hurt.
Which bike or a motorbike?
He was on a small motorbike. He's going slightly blue. Sweetheart, his lips are going blue.
Would you say they're struggling desperately for breath?
Desperately for breath, yeah.
Okay, got a crew on the way to you.
When a car hits a motorbike, even at low speed, the injuries inflicted can be life-changing. An ambulance has been called, and critical care paramedic Steve Mitchell, known as Mitch, has also been scrambled.
We're just off to Aston. It's about 10 minutes away to a car versus motorcyclist. Believe the patient's conscious, got a chest injury, and that's as far as we know, really. There's a crew on the way, and they'll be there before us.
If the man is struggling to breathe, he may have an obstructed airway. Mitch carries advanced airway equipment, including ventilators, so he can start treatment straight away and get him to hospital safely.
Hey up, you're all right, mate. How's it going?
10 minutes later, Mitch arrives at the scene and is met by fire brigade and ambulance crew.
No worries. I'm here. What's your name, sir?
Ian Allen.
Ian. What we'll do is we'll get you in the warm, dust you up a bit.
Yeah, okay.
All right.
47-year-old railway worker Ian was on his way back from work on his scooter when a car collided with him at a crossroads, catapulting him onto the road.
And is it your left shoulder, right shoulder?
All the left.
All the left, okay.
He is breathing on his own, but in a lot of pain.
It looks like it's probably dislocated or broken by the sounds of things. It's all right, just so don't pull anything.
There's a high chance Ian has injured his spine in the collision, so the ambulance crew have immobilised his head and neck to try and protect him from further damage.
On your count, Chief.
After 3, 1, 2, 3, lift.
Okay, stay as you are, and then slide the trolley in. Mind your toes, gently. Okay, keep going. I'll get the winch off.
Worried that the slightest jolt could leave him with permanent spinal damage, Mitch needs to use the winch to pull the stretcher up the ramp.
Okay, stop there. Okay, 1 foot, 2, half 6 inches, that's it, go. Hold on. Okay, slack taken up there, okay. Just makes it a bit smoother for you.
Once on the ambulance, Mitch needs to do a full examination to try and find the extent of Ian's injuries.
Yeah, I'm in a bit of pain.
Okay.
Can you get some gas in there, mate? I could do some water.
Courtney, you're all right to get some morphine drawn up and some paracetamol. He's in a lot of pain.
Well, yeah, I'm in pain, yeah.
Okay, here's a little bit of water. Just wet the whistle. Out of 10, how bad would you say the pain is in your arm?
Pretty bad.
10 being the worst ever.
It just feels like there's something wrong there.
Yeah, it will be.
It's my chest.
Your chest?
Shoulder.
Yeah.
All round there. It's really pain. It feels as if...
Chest up here as well?
Further down here. There.
Okay, right, okay.
Ian is in so much pain, it's clear that he has sustained some broken bones and potentially damaged internal organs.
Keep your arm low for me, Ian, okay, so we can pop a little needle in there.
Mitch's first priority is to reduce his pain so he can get him to hospital fast.
Get your pain sorted out, mate.
Ambulance service, patient breathing.
He is, but it's not very good.
She conscious, the patient?
No.
Not responding?
No.
How old's the patient?
Not really sure. He's 1934.
So he's 85 years old and he's not responding to at the moment to confirm,
No, he's very, very pale in colour. Very pale.
Is he taking regular breaths at the moment? Is his chest rising and falling evenly?
No.
Right, I hope it's all been arranged for him, okay? We are trying to get there as quick as we can on blue lights and sirens, okay?
The call is from a local care home. It is classed as a cardiac arrest, a code red emergency. An ambulance is en route, but critical care paramedics Alistair McNeil and Mike Andrews have also been scrambled.
What looks like a nursing home or sheltered accommodation for a cardiac arrest. Charlie 1 call. We're responding as we are one of the closest resources to the case. We have another crew that are en route as well, but no one on scene yet, as far as we know.
In the UK, around 7.5 million people are living with heart disease. As we get older, the heart and blood vessels stiffen, meaning the elderly are at greater risk of sudden cardiac arrest.
This is the time of the morning when people are getting up and they're moving around, and carers are making their first sort of visits of the day, so this sort of case is not uncommon at this time of day. A lot of the time they're hypoglycemic patients, so they're diabetics or even non-diabetics whose blood sugar has gone low and they've been found in an unconscious state.
Still a couple of minutes away from the care home, Alistair and Mike know they need to get there fast if they are going to intervene and save the man's life.
What we're going to do is we're going to get a needle in you, give you some pain relief through there, and that'll help the breathing, all right? Clench your fist a few times. That's it.
In Aston, Mitch is treating 47-year-old Ian, who was knocked off his scooter and has suffered serious chest injuries.
So he sat for 95 on air, just sort of coming up quite quickly there as well.
4 litres, yeah?
I'd go up a bit. Yeah, he's having a bit of difficulty breathing, I think, and like what's happened. Sharp scratch then. Okay.
Ian needs an urgent scan of his chest and lungs and is in so much pain it's affecting his breathing.
Yeah, sorry, Chief. Well,
I'm in a lot more pain than I was out there.
Yeah, it kicks in once your own painkillers wear out your system. If you want to chuck us that morphine, I think.
Any allergies at all, Ian?
Not really, no.
So this will make you feel a bit fuzzy, OK? Out of 10, how bad would you say the pain is there?
I'd say it's pretty bad. I'd say it's about 8.
About 8 out of 10, and you look like a burly chap that can take a bit of pain.
Ian's blood is showing low oxygen levels. He may have damaged his ribs and lungs, but until he can get on top of his pain, Mitch can't be sure of the extent of his injuries.
Can we just pop your head forward slightly? Not too much, not too much. Rest your head back. Rest your head back. OK. How's that? Can you feel that starting to kick in a little bit there?
Yeah, I'm a big bloke, it might take a while to get round.
Yeah. Nice slow breaths if you can. How's the pain doing there, Ian?
It's subsiding, but it's still there.
Yeah, OK, we'll get you. Yeah.
Have you put the morphine?
Yeah, that's gone through.
Yeah, it's gone through.
It's working now.
Yeah.
14:20, it started running through.
Finally, the combination of paracetamol and morphine start to take effect.
Stutter in his respiration there. I'll probably give him a little keep going until you've done the 20, I think.
With Ian still struggling with his breathing, Mitch decides to keep him on oxygen for the journey to hospital.
Oh, we'll probably end up going QE, I think, because he's got a chest injury. Yeah. How old are you, sorry, Ian?
47.
47, OK. Maybe just put a 250 bag of fluid on there, just run the rest of it through, just give him like a bit of a keep open or something like that.
If his blood pressure drops, the intravenous fluids will help to keep him stable.
Are we doing fracture? Left?
Ribs and shoulder injury. Left, yeah.
Police arrive to get details of the accident, and Mitch calls the trauma desk to update them.
Has it impacted you?
Well, I've gone into the side room, so
So where did you impact the car?
60, go ahead.
Crew are going to convey to the QE. You ready for details?
In the right hand lane.
Yes, fire ahead, Mitch.
So male on a small motorcycle moped. He's got a left shoulder lateral clavicle pain with left sort of lower rib injury, query fractured ribs, equal air entry, but it is affecting his respiration. And in light of his rib injury, I feel that it's suitable for the QE. They'll probably be about 15 minutes from now.
With Ian now in a stable condition, Mitch is happy to leave him in the care of the ambulance crew for the journey to hospital.
There's the crew.
In Quinton, Alistair and Mike have been called to a care home where an 85-year-old patient has been found in an unresponsive state, bleeding from the nose.
Good morning. Hello again. Hello again. You're right.
They are met by the ambulance crew, members of the care home staff, and happily a now conscious Ken.
So which nostrils of blood come out?
Both of them.
Both of them.
Ken and his wife Maureen have lived in their apartment in the care home for 8 years. He collapsed this morning getting out of bed.
How is he normally compared to this?
Well, we don't come into him for care.
So you don't know him too well? No.
Well, we know him, but we don't give care to him.
I know me, I'm always pulling the legs out.
Is that what you do?
Yeah.
Oh, I'll keep some on their toes, I would imagine. So when you sat up, you just felt a little bit dizzy?
Yeah. And I stood up and when I got round here, over there. It happened yesterday as well.
No.
Can I take spotted blood out your finger?
You can have it. Yeah, you can have it from it. I'll give you about 2 points while I've been in there.
Yeah.
You lost a lot from your nose, have you?
You've had no chest pain or anything, have you?
Nothing at all.
The crew take a sample to test Ken's blood to see if low blood sugar could have caused him to pass out.
Okay.
He was getting out of bed and the blood not going around my body quick enough.
Did you leap out of bed, did you?
No.
What was that? That normal?
6.9.
6'9"?
Yeah, 36.8 and 6.9.
Are you happy with his ECG and everything?
Yeah, I'll do 12.
The electrocardiogram test hasn't shown up any abnormalities in Ken's heart rhythm.
I can't manage it, Lord.
No, I know you can't.
If I hadn't given you this word, you'd have been flat on the floor. And I couldn't lift you up.
Happened again yesterday as well.
No, of course it didn't.
But Alistair is concerned that this is the second time he has fainted in 24 hours. The nosebleed could be a sign of high blood pressure or heart disease that needs investigation in hospital.
I don't think there's any need for me to go to us.
But Ken is not convinced.
We'll do all our checks on your Ken and then we'll take it from there, mate.
I ain't got to go.
Claire's coming in.
No, I'm not sure what we do.
Ken has a history of fainting when he gets up in the night, but has never had a proper diagnosis.
Did he go to hospital yesterday?
You didn't go to hospital last night, did you, Ken?
No.
You had it happen yesterday, you've had it happen today.
It happened yesterday morning, then he cleared up, not all right.
The carers.
What was his BP,
said,
James?
You've got to go in hospital.
123.
You were out for the account.
Got a good one.
Just.
Mike wants the crew to run another ECG scan to see if there are any signs of deterioration or unusual activity.
That's a nice scar you've got on your chest, isn't it?
What's that from?
20 years ago.
No, 20 years ago.
25 years, more than that.
Really? It's indestructible then, maybe.
A veteran of open heart surgery to unblock clogged arteries, Ken is made of stern stuff. But in the end, he listens to medical advice and agrees to go with the ambulance crew to hospital.
Okay, take care. Thanks very much. Thanks a lot, guys. Nice one. We'll leave you to it. We'll see you later on, no doubt. Nice to see you.
And Mike and Alistair are free for their next emergency call.